JSB Talks Digital.
Hello and welcome to JSB Talks Digital, the podcast for marketers, bloggers, business owners, and those of you bringing your skills into the digital age. I'm Joanne Sweeney-Burke, and this podcast is brought to you by Digital Training Institute. In this very special edition, I focus on digital in healthcare. I attend Europe's first Health Innovation Week in the Science Gallery hosted by eHealth Ireland and the HSE. I interviewed the Director General of the HSE, Tony O'Brien, on their digital agenda. The HSE's first ever CIO, Richard Corbridge, talks to me about how digital can democratise healthcare for the patient. I experienced 360-degree video and virtual reality in healthcare innovation. Have you ever heard of exponential innovation? Well, I interview Professor Joe Haslam on the subject. I join a media panel to share my views on how social media can tell the story of healthcare and technology, and find out how 360-degree video can provide a more immersive experience for your customers.
Interviews.
I attended Europe's first Health Innovation Week and it was an amazing experience. Having done some work with the eHealth Ireland team, I was interested to learn more about how our National Health Service is embracing the digital age. We all know that 8 years of austerity has meant that technology has been the poor relation of advancement. However, things are changing in the HSE, and I wanted to go along personally to find out how it is changing and what impact it will have on me as a patient. Firstly, I interviewed the Director General of the HSE, Tony O'Brien, who says that while they are slow to embrace digital, they have the benefit of learning from others' experiences and their mistakes.
JSB Talks Digital.
Tony O'Brien, you are the Director General of the Health Service Executive here in Ireland. We're here in the Science Gallery for the Health Innovation Showcase. You've just gone around the Startup exhibition. What did you find?
I found tremendous innovation, which is what I expected to find. It's interesting, this started as a Health Innovation Day and it's grown into a whole week. We have wonderful exhibitors. I've just seen what will in the future be the health portal, where every patient will be able to get access to their own health records, book appointments, look at their own blood tests, whatever it may be. This will really empower Irish patients and make the health system much more effective and efficient for people who use it. I've also looked at our innovation team. The whole point of what we're doing is to make the health service more dynamic. And so our quick team is making it possible for all sorts of potential providers to get access to startup funding, to develop new ideas that otherwise wouldn't come to fruition. And we have in Ireland tremendous innovation capability. I think it's the job of the health service to support and facilitate that. And that's what we've been about with our whole eHealth agenda. I've also looked at the way virtual reality technology can empower both training and patients throughout the health systems. It's a really very exciting day.
So there's two big projects ongoing at the moment, being spearheaded by your CIO, your first CIO in the Health Service Executive, Richard Corbridge. Talk to us about the electronic health identifier number and electronic health records.
Well, less than 2 weeks ago, I was able to sign a memorandum of understanding which creates the individual health identifier. This means that all 4.6 plus million people in Ireland will have an individual health identifier for them and for us. This means that all of their health records can be connected both by them and by their authorised treating clinician. For the first time, this means we won't have to have unnecessary duplication of tests. Information will be available more quickly on their point of presentation, particularly if it's an emergency presentation, and this can only produce a better outcome. So we are leapfrogging a couple of generations effectively by bringing that about. That all needs to be part of a seamless electronic health record, which is joining together systems that we already have. A key element of this is empowering patients, service users, their families as appropriate, with the individual patient's consent, to access all the necessary information so that they can see the information the health system has about them, they can see who's looking at it, they can have a degree of democratic control over their own health information. This is a huge leap forward, and I think it's going to make the difference between a poor health system and a really good health system, combined with some of the other measures we're taking. So I think this is one of the most important developments in Irish healthcare for a generation. The whole eHealth programme, which is at the centre of my programme to build a better health service, is only 2 years young. And when we look around and see the tremendous change that it's already brought, it's shown that by releasing and giving freedom for innovation in a system of over 100,000 health professionals, all of whom are really committed to doing their best, by giving them the freedom to do what they do best.
So you spoke about the HSE being late to the healthcare innovation party, if you like, but has that given you an opportunity to look at evidence-based best practice and what's been happening across the world? We've heard from the NHS today and from other health services across the world. So what are you learning?
Well, I think we're learning from their mistakes, and it's great to have the opportunity to learn from other people's mistakes. We're also learning that it may not have been a good thing for us if we were one of the first innovators. And for a variety of reasons, we're late to the party, but this has happened to us in other domains. We were very late, for example, to have a national breast screening programme, and we were the world's first fully digital health screening programme. So we're in a position to leapfrog technologies to, as it were, not in one bound, but very quickly move from an industrial age healthcare system to a digital age healthcare system without having to go through the learning curve that so many of our colleagues have gone through. So, and that also means that we don't have recently invested legacy systems that we have to make the case to rip out. We don't have those systems. So what we are taking as our biggest lesson is that this isn't about building a single, shiny, monolithic system. This is about taking the platforms we have, incrementally adding to them in ways that are connectable, and joining up all of these systems in a way that's easy to use. That's the type of thing the portal that I've spoken about before is enabling. So we won't be making the mistakes that others have made. We'll have the benefit of their learning, and many of them are here to freely share their lessons and their advice, which is a great resource that we have. So I believe that we're on the brink of something really special in Irish healthcare.
I also had the chance to speak to Richard Corbridge, who is CIO of the HSE. He talks to me about the changes he has brought about in the organisation since he joined 2 years ago. Richard is an evangelist for healthcare innovation and spearheaded Health Innovation Week and indeed many other public events to ignite public conversations around digital transformation in healthcare. The Office of the Chief Information Officer is responsible for the delivery of technology to support healthcare across Ireland. The core of their eHealth strategy is to bring improved population well-being, health service efficiencies, and economic opportunity through the use of technology-enabled healthcare provision. Richard tells me how he is bringing about change in Ireland's healthcare service, which has 110,000 staff and a patient population of 4.6 million.
JSB Talks Digital.
Richard Corbridge, you're the CIO of the Health Service Executive. We're here in the Science Gallery for the Health Innovation Showcase. Your original half-day idea actually grew into a whole week. How did that come about?
How did it come about? Mostly through lots of the team coming together with different ways they can work on what we're trying to do. I think the idea of innovation and trying to grow the event itself almost grew through innovation because of the different ways people came up with more that we could add to it, different ways we could put different things in place, from hackathons through to IoT World, through to HIMSS. It's all exponentially changed the way people think about healthcare.
Now, you're only in situ as Ireland's HSE's first CIO 2 years. You seem to be like shaking up the healthcare industry in Ireland and almost, excuse me, but making it sexy.
No, I hope not. It's interesting because one of the comments that some of the team had recently was they want to be involved in the sexy projects. I think there's some big parts of some of the fundamentals that need to be considered as well. So infrastructure, how we actually continue to deliver, keeping the lights on, service management, things like that, which are often not seen as the sexy new stuff, but are just as important as what we're going to do.
Talk to me a little bit about the electronic health record and the individual health identifier, those two big projects that you're working on.
Okay, so individual health identifier first is something that's now built. It's ready to be rolled out as soon as the Minister signs the last part of the Act itself. What it does is it effectively acts as a bank account number. It means that wherever your information is, it can be uniquely identified and attributed to you, and that's really important. It's not health information. It's absolutely demographic information and very much an account number with healthcare.
And the electronic health record?
So EHR, the electronic health record, is 4 pillars of a large procurement: a community, an acute, an integration capability, and a summary care record. Different ways of deploying electronic capability into different care settings, giving us integration, allowing us to have integrated care.
What does that mean for me as a patient? Does it mean that I'm going to be empowered by having access to my health information?
It certainly does. One of the parts of an EHR is to now give you access. Today, if you asked a hospital to have access to your records, it would take them weeks to collate all the papers that are in all the different rooms, pull them together, and then give you a big brown envelope. With an EHR, you can start to have access not just to your record, but importantly and uniquely for Ireland, to who has looked at your record as well.
And are patients and the citizens of Ireland excited about this, or will they be?
So far, there's been a good groundswell of opinion around doing it. We have to be careful around privacy. We have to make sure people have the option to consent to have an electronic health record. We mustn't mandate an electronic health record to every person in Ireland. People sometimes don't want information to be shared. But our stance around exposing privacy, exposing who has looked at the record to the patient, I think is a good starting point that brings some difference.
Well, I suspect that social networks such as Facebook has far more information on us than perhaps your EHR will have. So thanks very much and congratulations on an amazing week of events.
Thank you very much.
Joe Haslam is an associate professor at the IE Business School in Madrid, which is ranked as the 5th in Europe. In the MBA programme, Joe teaches an elective module called $1 Trillion Opportunities, which focuses on the impact exponential technologies are having in fields such as energy, telecoms, agriculture, health and education. Born in Limerick, Joe has lived in Madrid for the past 12 years. In this interview, he tells me exactly what exponential technology is and how it can be applied to healthcare.
JSB Talks Digital.
I'm joined by Professor Joe Haslam from the IE Business School in Madrid. We're here at the Health Innovation Showcase in the Science Gallery. Joe, tell me about exponential technology for the healthcare sector.
Well, exponential technologies are technologies that go beyond the digital arena. Most people talk about digital, but to go beyond digital, you actually find exponential technologies. And those are technologies that are work by the power rather than by just multiplying, in other words, copying like digital technologies. So what you can have is something that will take 30 steps in a digital arena, will take 36,000 steps in an exponential arena, which basically means change comes much more quickly than you ever expected.
So I believe that we are living through the slowest pace of digital change thus far in the living world. Is that true? Is technology and digital going to exponentially grow at a more rapid rate?
Yeah, well, I mean, it already is. If you think about, I mean, the mobile is an exponential device, and look how that's changed. Facebook is an exponential product, so there are lots of things that we already have in our life. But the exponentiality, you can think in terms of things getting smaller and also things getting faster. So in the healthcare arena, you're thinking of getting smaller. So that means you can put things into your body that can collect data, and that's hugely revolutionary. But you also have things like robots. You also have things which are particularly for older people. You can ask the same question to a robot as many times as you like, and they'll never complain. But you're also even seeing things in genetics. It's possible to work out our individual genome and therefore to manipulate genes. And there used to be a time when that was prohibitively expensive, whereas now it's a lot cheaper, and I think those are technologies we'll almost certainly see, maybe not in 5 years, but certainly in 10 years.
Joe, thanks a million.
Thank you very much. Bye-bye.
Shoutouts.
My shoutouts in this episode go out to 3 organisations who are trailblazing technology in healthcare and putting the patient at the centre of their innovations. To expedite care, reduce patient waiting times, and facilitate rapid access to senior decision makers, Tallaght Hospital in Dublin has introduced Lucy, a robotic doctor. I had the opportunity to meet Ireland's first robotic doctor and see her in action. Lucy is a remote-controlled robot, part iPad and part Segway. She allows doctors to attend to patients from other areas of the hospital, or indeed even if they are out of the country. Clinicians at Tallaght Hospital say Lucy combines the flexibility of telepresence with the benefits of personal FaceTime. Lucy can extend to 5 feet so she can talk to standing patients, and by dropping to 3 feet, she can be at eye level for patients in bed. It was brought to Ireland by Professor Paul Ridgway, who did a full ward review from Lisbon recently using Lucy. I interviewed Ray and Kathleen on how Lucy is adding value to the patient experience at one of Dublin's busiest hospitals. So check out that video on this blog to find out more and to see Lucy in action. The Royal College of Surgeons in Ireland has developed the world's first fully interactive virtual reality medical training simulator, allowing users simulate emergency room management of a patient following a road traffic accident. The RCSI VR Medical Training Sim app puts medical professionals and trainees in the shoes of the emergency department trauma team leader, where they must assess the patient, make life or death decisions in real time, and perform life-saving operative procedures as a surgeon would in a real emergency room. I tried it out and it's amazing. I captured it on video, which you can catch on the blog. The app is now available for free download on the Oculus virtual reality platform. The HSE's communications team launched its live chat web feature to support improved customer service. I met with the team at the Health Innovation Showcase and they talked me through the real-time live chat feature, which goes fully live in January 2017. However, you might see it pop up as it's being tested on hse.ie. Watch my videos to learn more about these groups doing amazing things in healthcare innovation. They are on the blog post associated with this podcast, and you can also view them on the Digital Training Institute YouTube channel.
JSB's column.
I joined a panel of media experts at the eHealth Ireland Health Innovation Showcase to help answer the question: how can we leverage the media, traditional and digital, to communicate healthcare innovation? To help flesh out that discussion, I have decided to set out my approach to communicating healthcare innovation successfully on the social web. Social media is the place we hang out to learn, to be inspired, to be informed and to be educated, but also to help us engage with others who share our interests, our beliefs or our passions. When it comes to healthcare innovation, we are really talking about the community being made up of patients, clinicians, healthcare decision makers and administrators, politicians, vendors, suppliers and innovators. So, if you were trying to tell the story of healthcare innovation, what should be your approach? Here is my 8 steps of advice. Firstly, make a compelling argument that has the patient at the centre of the technology. You must bring the technology to life by applying its benefits to real life. Feature real patients using your technology. What has been the impact, the benefits, the improved life expectancy, or the improved quality of life for the patient? This will have better impact than bombarding us with tales of technological heroics. Thirdly, segment your online community by topic and interest, because we all know that social media attracts like-minded individuals that join communities based on their interests. Build a community of advocates who will become your brand ambassadors. This should happen organically. If you are engaging in digital storytelling to a cohort of dementia patients, for example, on a new innovation to improve their quality of life, then it makes absolute sense that they would champion your stories if they feel involved and their voices are heard. Give a voice to patients who seek to be heard and ensure your policy of interaction lends itself to patient and service user advocacy. Don't shut down negativity or block voices. Develop a robust policy of inclusion which also protects you from trolls. Embrace and create multiple content types, but put a laser-sharp focus on video content. Funnel all social fans back to your website for more information. Interactions from the social web should be redirected to your main communications hub, to relevant landing pages which add value to your community's interactions. Use all social networks to reach different demographics and repurpose your content to fit each channel. You will need to be platform agile to respond to changes and updates on the social web. Measure the impact and reach of all digital conversations and use insights and analytics to help better decision making. Iterate and keep evolving. Don't stand still. Move as the platforms move and respond to the changes in your community's online behaviours. If you want to know more about the eHealth Ireland strategy, log on to ehealthireland.com. You can also find out more about Healthcare for Ireland in 2030 by logging on to eh2030.com and follow the conversation on the hashtag EH2030. You can watch extracts from that panel discussion on the Digital Training Institute YouTube channel.
Social media tool of the week.
This week I recorded my first ever 360-degree video. The team from Samsung Ireland kindly let me use their Gear 360, which is a very impressive camera. I decided to experience virtual reality while at the same time have it recorded on a 360-degree video. I then uploaded it to Facebook and to YouTube. As you know, both channels support 360-degree video, which is created with a camera system that simultaneously records all 360 degrees of a scene. Viewers can pan and rotate the video to watch it from all angles. Keep in mind that 360-degree videos on Facebook are limited to a maximum length of 10 minutes and a maximum size of 1.75 gigabytes. Jump onto the Digital Training Institute Facebook page to see my first ever 360-degree video. I certainly intend to record more of them as the content is hugely engaging and immersive. Thanks as always for tuning in to JSB Talks Digital. I want to personally thank Richard Corbridge, Maria O'Loughlin, Elaine Naughton, Hannah Greaves and the entire OCIO team who facilitated me during their inaugural Health Innovation Week. As you know, I really enjoy getting inside large organisations to explore how they are digitally transforming and embracing the social web. I have a series of videos from the event on the Digital Training Institute YouTube channel, so please check them out. To ensure you never miss an episode of JSB Talks Digital, make sure you subscribe on your smartphone, on iTunes or on Stitcher. You can also subscribe on SoundCloud. Give me 20 minutes of your time each week and in return, I will empower you with digital marketing and social media knowledge for free. If you're interested in becoming a guest on JSB Talks Digital or have an event you want to promote, then drop me an email to joanne@digitaltraining.ie. You'll also catch me on Twitter @tweetsbyJSB or on Snapchat @JSBSnaps. I'm Joanne Sweeney-Burke. This has been JSB Talks Digital. Thanks for listening and I'll talk to you soon.
JSB Talks Digital.